Thank you for joining us on Awareness Day 2026, where the Paget's Association has a focus this year on pain in Paget's disease. And I'm really pleased to introduce and welcome Professor Chantal Chenu from the Royal Veterinary College, who's going to tell us a little bit about her research in this area. So welcome, Chantal.
Thank you.
I'd just like to start by thinking generally about pain. So pain is the most common cause for patients to consult a GP, and pain is one of the most common symptoms associated with Paget's disease. What do we know about the frequency of pain in Paget's disease, and what do we know about its causes?
Yeah, so bone pain is the main clinical manifestation of Paget's disease of bone, and patients describe their pain as constant and dull, and it considerably reducing their quality of life. So we think approximately 70% of patients experience pain, and the mechanism of pains are not very well known. But we know that pain can arise from bone deformities that are present in Paget's, microfractures, periosteal stretching, but also an increased blood flow and an increased bone metabolic activity that takes place in the bone of these patients. We also know that pain is frequently associated with osteoarthritis in these patients.
It's really interesting that if you kind of think of bone, you maybe think of it as being a very inert material, but clearly what your research has shown and what others have shown is that bone is able to sense pain essentially. So why is it that bone is painful, or how is bone able to kind of recognize these pain signals?
Yeah, bone is very metabolically active and it contains a lot of nerves. And we didn't know that bone was so highly innervated until we had the techniques to look at the expression of nerves in bone, because it was difficult due to the fact that this tissue is highly calcified. But about 30 years ago, our groups have shown that actually bone is highly innervated by both sensory and sympathetic nerve fibers. These fibers are running in parallel to blood vessels, and they are very close, at close proximity to bone cells, suggesting that they may affect their function. So we think that we know that all parts of bones are highly innervated, but the periosteum, which is the envelope that covers the bone, is the most densely innervated.
That's really interesting, and it's easy to forget, isn't it, that bone is a living tissue, and as you say, it has a blood supply and a nerve supply as well. So, yeah, that all starts to make sense, I think, with understanding bone pain and bone pain in Paget's. So, what's the specific aim of your research in this context? Could you tell us a little bit about some of the work you did working with the Paget's Association?
Yeah, so our aim of research is to examine if the increased acidification of bone tissue, which is due to excessive osteoclast action in Paget's disease, may contribute to this pain experienced by the patients. We know that the bones of Pagetic patients contain these giant hyperactive osteoclasts that resorb bone. They have the ability to form a very acidic environment because they secrete protons. And because the bone is densely innervated, it's likely that these very large osteoclasts can be in contact with these sensory nerves, which are called nociceptors, and that there is an acidic environment which could activate some ionic channels that are sensitive to acid, which are called acid-sensing ionic channels. They are expressed by these nerves, and when they are activated, they could send signals to the brain to induce the pain. So we want to determine in our models of Paget which pain symptoms are present, if the expression of this acid sensing channel is upregulated in Paget's disease of bone, and if the increased bone resorption contribute to this increase in pain signals.
So that all makes sense, really, then. So the acid that's needed as part of that normal bone remodeling process that the osteoclasts produce, um, in a condition like Paget's disease, where bone turnover is accelerated, then there's more acid, maybe in excess, and maybe it's that acid that's stimulating the nerves which are linked to and innervated by bone. So yeah, that's
Indeed.
really logical. Thanks. So could you just outline some of your major results? And we're really interested, obviously, at the Paget's the experience of living with pain. So how might the research you're doing help patients with Paget's associated pain?
Yeah, so we first, our results demonstrate an increased sensitivity of Pagetic bone to mechanical stimuli. And this is interesting because this is in agreement with a recent study which was performed by Professor Stuart Ralston in Edinburgh. They showed that the skin overlaying the Paget's affected bone exhibit increased mechanical sensitivity and reduce pain thresholds compared to the unaffected sites, suggesting that there may be altered sensory processing that may occur in this patient. So this was a very important result, this increase in mechanical sensitivity. We also showed that in Paget's disease of bones, there is an increase in expression of these acid-sensing ionic channels, and that they may, when they are activated, they may contribute to pain. So this is really important for Pagetic patients because it may be possible in the future to develop pharmacological therapies targeting at these acid sensing ionic channels to reduce the pain. I would say that we have also observed another interesting result is that we observe many sex differences in the architecture of bone in Paget's, as well as in the bone response to external stimuli. And we think this might be a very important field of investigation for the future.
Thanks, that's really fascinating. So I guess to sum up, what your group has, and your research has shown is more of a molecular explanation for the mechanisms of pain in Paget's, and that's a real step forward because, as you say, that's the the next step in the pathway towards having better management and better therapies as well. So wonderful, thank you, thanks Chantal, and we really appreciate you taking the time to tell us about your research today. Thank you.
Thank you very much.